Hi, everyone. Thanks a lot for taking your time out of the evening or morning, those who are in the morning hours, and join our very interesting webinar today. We will talk about awesome topic and very popular topic, and I'm getting these questions and this problem very often with my patient, and we're gonna talk about this. Again, please find the chat button, those who have any kind of questions now or during the presentation or after. Please post all your question in the chat topic, and when I will finish, I will come back to that and answer all your questions. But I hope during the presentation, I will give you enough information that to cover all your questions, everything that you have. So let's start. Let me share my screen and we will start the presentation. Okay, so today we will talk about healthy fertility, and we will talk about how omega-3 plus and LAMININE, these two very good and very well-researched supplement, can help you with fertility, to increase fertility and to have a healthy fertility. And like I said to Jean a little bit early, researching, creating this presentation led me to some very interesting research and opened some interesting information to me that I didn't know before. And I'm so happy to share with you how fertility means showing the health of a man. And the healthy fertility is not only to create children, but it's also keep men healthy for a long period of time. Let's dive in. Those who came here first time, welcome. My name is Yana Atamari. I have a master's degree from University of Western State in human nutritional and functional medicine. I also certified nutritional consultant. I worked in different settings in functional medical centers and also creating different webinars and different educational programs. So what is fertility? Remember, like we always do, a dive crush biology course 101. So let's see, just to understand what is fertility, what is the meaning of this word. It's not being able to get pregnant despite having frequent unprotected sex for at least a year. So if a couple trying for a year and they're still not pregnant, that is considered infertility. I'm sorry. So how common is infertility? How often we see this problem? And sorry, excuse me. In United States, about 9% of men and 11% of women are experiencing fertility problem, and about 12 to 15% couples cannot get pregnant after a year of unprotected sex. And 1/3 of this couple will face the problem because of the man, 1/3 will face the problem because of the woman, and 1/3 can have both or unidentified problem, or both men and women have a problem. Talking about man problem, that the trends, this the sperm count, I'm sorry, something up with my throat today. The problem in the sperm count, it's really the problem. It's in this systemic review, they looked at men with the fertility problem from 2014 to 2020, and it's included 3,000 studies. And they see that actually the problem, the decline in sperm count, is accelerating. So if average before it was dropping down 1.16% per year, from 2020, it's dropping 2.64% a year. So this decline in sperm count is accelerating, is getting more and more exaggerating problem. So right now the sperm count dropped from almost double from 73 to 2019. Azoospermia, this is the absence of motile or viable sperm in semen. And this is the problem that some men face, and that is the problem of lack of the pregnancy. And one of the things that I didn't know is that the like I said to earlier, that male fertility is the barometer of the man's overall health. And those in United States, 15% of men from 15 to 45 are infertile. So this is the problem, not just because they cannot make women pregnant, but it's also they have higher risk of getting a cancer. So infertile men had 1.7 times are likely to develop cancer than men who are fertile. So this is not at this point, this is a bigger problem. This is really the problem of overall health of man. And of course, one of the problem of declining of the sperm count and the sperm quality is environmental factors. And in this narrative review, you can see that things like air pollution and chemicals and excessive heat, and we'll talk a little bit more about this. This is all influence the quality of the sperm. So air pollution, so exhaust from the motor vehicle, factories, household, waste treatment, oil refineries, this is all air pollution that are damaging the health of any person, but it's also one of the factors that influence the fertility of a man. Also, exposure to harmful chemicals, pesticides, phthalate, heavy metals, and they're everywhere, including food. Dioxins, it's a bleaching, chloride at home, all this bleach cleaning at home. This is all also playing a big vital role. Pesticide and herbicide in fruits and vegetables. That's why choose a local farmer, healthier farmer, have your own garden. Phthalates, it's everywhere, pharmaceuticals, toys, including sex toys, cosmetic products, everything around you, it's all, there are a lot of chemicals around, and it's all influencing the health of the sperm and the health of the man's health. That I'm sorry, something up with my throat today. The temperature, the crotal temperature in men is a little bit lower than a general body temperature. And that's why every time when the temperature is rising, even a little bit, 1 to 1.5 Celsius elevation, it's already impaired the sperm production. That's why men if the couple is trying to get pregnant, men should avoid heat. And it's jacuzzi, saunas, hot tub, excessive exercise, it's all have to be avoided. Also, harmful activities and agents, all the toxicity that we're talking about, also drugs and smoking, alcohol, of course, healthy weight, this is for overall health, and avoid the pesticide, heavy metal, all these chemicals that we were just talking about. This recommendation increased the sperm count in 50% of the cases. So standard methods to treat male infertility. Of course, normal sleep, good nutrition, normal sex life rhythm. And if you have any kind of, if men have any kind of diagnosis, underlying condition, they have to be treated and they have to be addressed. And the moment of fertilization, both men and women have to be in the best health, in the best shape. That's why a lot of couples actually come to me that are not trying to get pregnant now, but they are preparing to get pregnant, and they trying to get into very healthy state of life when they will get pregnant. So of course, adjust your health routine. Like I said, eliminate overheating and any kind of extreme workouts that cause not only elevation of the temperature, but also extra stress. And of course, the factors, all kind of chemicals, and the mood, the depression, anxieties, and just like I said, be in your best health. The diet. Of course, I have to talk a little bit about the diet because it's play a huge role and it can influence male fertility. Oysters, they are contain high amount of zinc, and they are big helpers. Zinc is it's very helpful just in a lot of processes, including immune system, but it's also help with male fertility. Fruits and vegetables, of course, it's not just fiber, but it's ton of antioxidants, and the brighter the color, the more antioxidants you're getting. And nuts and seeds, but walnut in particular, very helpful. Make sure to keep them in refrigerator to preserve their freshness. Fatty fish that contain a high amount of omega-3, and we talk a little bit more about fish later. And maca root, that's also, there is not much studies about this, but there is some information about this, about the increase in sperm concentration and motility. And this is the clinical observational protocol I want to talk about that was done with the patient in Medical Center Echo Park. And they took a male from 25 to 55 who had a diagnosis and were treated for sterility. And 40 patients were divided in two groups. They were pretty healthy. Nothing was wrong with them, except they could not get women pregnant. And also they didn't, during this protocol, they didn't change anything in their diet or lifestyle. So two groups were divided into two. The group were divided into two subgroups, and one group took the patient were taking 2 pills of the LAMININE and 2 capsules of omega-3 plus. So this was the the study done with the live farm products. So they were taking one LAMININE and 1 omega-3 plus morning and in the evening, so 4 pills in total. And another group were taking placebo, of course. Now let's see the result that they got. Those who were taking LAMININE and omega-3 plus, they showed improvement, and the results come out in 3 months. So 3 months they were taking 2 pills each, and in 3 months there was improvement in spermogram, and they was compared, of course, to the control who didn't got any supplements. They were just getting placebo. I believe it was calcium. So as you see, there was this 85% improvement. And there was in 3 months, 20% of men in the group of LAMININE and omega had a successful pregnancy. 85% of male in the group with the LAMININE and OMEGA plus supplement, they show improvement in spermogram result. So they improve in the semen quality, sperm variability, and sperm motility. So you see this kind of supplements, and like I said, I will repeat, this was done with the Life Farm supplements with the LAMININE and omega-3 plus. And that's for 3 months, men was taking this supplement, and that is results they were getting. So they saw in the end of the study, they saw that both supplements were well tolerated by patient. There was no any kind of adverse reaction, any kind of problem with that. And also, so the results show that these two supplements are very beneficial to get the result these men were looking for. So let's talk more about these two supplements, the LAMININE and omega-3 plus. Let's start with omega first and see what kind of ingredient, what is in the supplements that were helpful for this man. First of all, of course, I have to start with the CoQ10. And this is the great antioxidant. And if you will look in omega-3 plus supplements, you will see CoQ10 is one of the it will be in the ingredients. So it's contained, the CoQ10 is contained in omega-3 plus supplement. CoQ10 is very, very powerful antioxidant, and it's needed by every cell of our body for the growth and maintenance. And we are losing the level of CoQ10 with age, but also people who take in medication, they are also losing CoQ10 even faster. And CoQ10 we need for the energy production and for a lot of biochemical reaction. And it's well known, we are very, very well aware and very well researched about the anti-inflammatory and antioxidant effect of the CoQ10 and its benefits in a lot of things, including the men's fertility, but it's help with the heart health, blood pressure, brain disorders, diabetes, migraines, and of course, people who taking any kind of statins, they have to check and maybe even supplement with a CoQ10. And that's why this omega-3 plus supplement is so helpful, because it's contained all what's needed. So CoQ10 in omega-3 plus, this is the review. I put how the importance of CoQ10 in male fertility. And there are 3 studies that showed that one study was 114 patient, 20 men and 77 men. So there are these 3 studies I put you to show that all these patients who were taking CoQ10 and it was just CoQ10 or CoQ10 combined with something else, for example, multivitamins or just vitamins like vitamin and mineral complex, they all had results after taking the CoQ10. And the big difference between CoQ10 that you can see on the market and the CoQ10 that you can see in omega-3 plus supplement is the absorption. And there are a lot of times when I say to my patient, you are not what you eat, you are what you absorb. And that's also in the supplement as well. It's very important to have quality supplement that you can absorb. And this CoQ10 and omega-3 plus has very unique formula that it's staying way longer in the bloodstream, and it has way better bioavailability. So that's why this CoQ10 in omega-3 plus is so powerful and working, and does it work so good. Another ingredient in omega-3 plus is vitamin K2. We know K1. K1 is found in leafy greens, and we need K1, and it's very easy to find, especially if you're eating any green salad on the regular base. But also vitamin K2, it's a little bit harder to get. It's we find it in the animal food and fermented food, but it's a very small amounts there. So we need K2 very much because it's play a huge vital role in our health. For example, it's transfer calcium into the bone, so making sure that all the calcium are not go to your artery but go to the bones. That's the job of K2. But also K2 increase secretion of male sex hormone, and it's also help with the fertility, but also it's protect from cancer. And it's K2 is fantastic vitamins, and addition of K2 to this omega-3 plus was a really great decision by Life Farm, because it's creating this nice, beautiful package. And of course, there is omega-3 and omega-3 plus, and that is the study I put you to see that omega-3 supplement together with a dietary intake improved the semen quality, and it helped with when there is an issue of infertility. And there is this study with 74 subjects who were taking omega-3 for 10 weeks. And they had, because of this antioxidant effect of omega-3, it's really helped with the quality of semen. The problem is that with omega-3, why I'm even talking about omega-3 supplements, even though, like I said, there is a lot of omega in the fish, but unfortunately, we cannot have fish every single day. The fish nowadays contains a lot of harmful chemicals, and it's absorb a lot of things that the fish eat in the waters it swim. And FDA, and dietary guidelines for Americans, they all recommended to have fish, but mostly they're recommended to have it like once a week. And we need adequate amount of omega-3 on the daily basis. That's why supplements like omega-3 plus, it's a great solution to have every day, to have adequate amount of omega-3 in your bloodstream. And of course, the supplement, the LAMININE. LAMININE is fantastic formula that has this avian egg after fertilization, and it's contained this amazing things that prepare for the by nature for the baby chick to develop. And it has all the protein, antioxidant, immune defense factors, the growth factors, everything to develop a healthy baby chick. And that's one of the reasons that it's helping with the male fertility, especially the study that I was just referring to. So how do omega-3 plus and this to supplement omega-3 plus and LAMININE, how do they help with the fertility? How did men who were taking this to supplement achieve such an awesome results? Like I said, it's very, very difficult to have this correct amount of omega-3 that omega-3 required in so many pathways on the body, in so many processes. Body very craving. It's in each of the cell. And you can listen to my previous lectures about omega-3, where we were talking about the role of more deeply. I was diving in and role of omega-3 in the body. But omega-3 is in each of our cell. Body needs omega-3 in the big amounts. And as we cannot have fish every single day, and we cannot have like ton of fish every single day, we need these supplements to support this adequate amount. But particular omega-3 plus supplements, it's contain these other nutrients that we were just talking about that also play a role in this results for this man. And this study showed that particular these two supplements, and I will repeat again that this study was done for these both supplements from Life Farm. So the study showed that taking these two supplements for the 3 months gave this the results of the increase in spermogram and the increase in the pregnancy rate. So both of these supplements, they are absolutely safe to consume. They are, especially omega-3 plus, they are done with the high quality fish oil that goes through molecular distillation, and any kind of toxin, any kind of harmful possibilities that is there, they're all being removed. And this the raw material, they are tested before and after the process to make sure this is the highest quality you receive. So both of these products, the omega-3 plus and laminate, both of the products are done with the high quality ingredients that doesn't contain any pharmaceuticals or any kind of substances that are not supposed to be there. Don't forget that those who has allergies, a person who has allergy to eggs, fish, and soy shouldn't take these supplements. And please make sure to talk to your doctor before taking any new supplements. LAMININE and OMEGA are taking like in the protocol, each 1 pill of LAMININE and 1 pill omega-3 plus in the morning and 1 of each in the evening, and best to do it with the food. And don't forget, of course, about other supplements in the line that also helping with the health and immune support, with the digestion and anything else to help you to be in the best health and shape. And let me check the chat and see if there are any questions here. The food chain contributes to infertility in both men and women because of high fructose corn syrup, high salt and sugar consumption, as well along with frankenfood, a lack of mineral in the soil in our food chain. Absolutely agree. This is a big deal, that especially things like high fructose corn syrup, salt and sugar, they all giving a lot of inflammation in the body. And that's exactly how LAMININE and omega-3 plus working, especially of the omega-3 plus and CoQ10 that in omega-3 plus, they contain this antioxidant and they are reducing this inflammation. I will not say that just keep eating like you're eating and take the supplements, because you cannot supplement your way out of healthy eating. When you're taking a great supplement, you have to make sure you eat a healthy diet, a very nutrient diet. And we were talking about fish, fruits and vegetables. They're extremely important. But yeah, this lack of minerals in the soil, that's for sure also one of the cause. This is two supplements that help a lot with inflammation. And inflammation is it's not just fertility, it's the overall health. And it's extremely important to be, like I said before, on the top of your health when you creating a baby, because this information that you're giving, when you're creating a baby, it's extremely important. Environment the baby will grow is also extremely important for the health of the baby, and for mom to have this best nutrients in her body, to have enough to raise a baby, but to have for herself as well, because we don't want woman to really be on her last breath in the end of the pregnancy. Let me see. So the study was conducted by Echo Park Medical Center, Echo Park, and there was 40 couples, 40 men with, I believe, age 25, 55. And these men were they were patient in this medical center, Echo Park, and they were coming there because they were sterile. And there was 40 men with the official diagnosis, and 40 men were dividing into two groups. So 20 were taking placebo and 20 were taking the life form supplements. So that's the amount of participants. You can see in the slide Echo Park Medical Group, Medical Center, Echo Park, LLC. But thank you so much. Thank you so much for coming, for asking the question, for listening to me. Please look at the YouTube channel for my previous presentations. There is a lot of very interesting information there, and I will see you next month. I'm sure it will be something interesting for you. Take care, have a great weekend, and I will see you next month. Bye for now.